Good evening, Miss J. How are you? I love your glasses. How are you doing? How are you doing? Forgive me as I'm trying to adjust this iPad so it doesn't fall over while I'm talking. Okay, I think I got it. How is everyone doing? Let me put my glasses on so I can see what's coming up on the screen. Let's see. How are you doing? Hello, Miss Leah Anderson. How are you doing? Hello, is it Torrey Clark? Hopefully I said that name right, Torrey Clark. How are you? And that's Kenzie Brown. How are you doing? Hey, Dr. Hooper. How are you? Thank you so much for joining me. Hua. How are you doing? Thank you so much for joining me. I know it's football season, so I'm kind of surprised that you're not watching football. Thank you guys so much for being here. Just give me a few minutes. I know who Wrenches is. Hey, Wrenches78, how are you doing? I know who that is. How are you doing? Good evening, everybody. I had to get me a little coffee because I was a little sleepy, so forgive me if you see me sipping. I hope everyone is having a good evening so far. I was just waiting for my moderator. I'm not sure. I called her and she didn't pick up, so I don't know if she's tired, she's sleepy. I'm not sure if she's coming this evening. And is that hello, everyone. I'm just waiting for some of my moderators to come in. Thank you guys so much for being here. Thank you so much for being here. Let's see. Hello, everyone. How are you doing? Just give me a few minutes to let some people in. Dr. Hooper, you not watching football? Well, hello, Jackie from Indianapolis. Thank you for joining me. You're at work? Good. So you get to listen while you're at work. Let's see here. Thank you guys so much for being here. Thank you so much for being here. It's on. Oh, you watching and listening at the same time, huh? Oh, thank you, Dr. Hooper. That's so sweet. Thank you. I appreciate you. I don't even understand football. My father was a football coach. Thank you so much, Miss J. My dad was a football coach, a high school football coach, and I still don't understand football. Hi, Hazel. Hello, everybody. Just give me a few minutes. Let's see here. Make sure I got all the... What moderators we got on here? Let me look around. Let me see what moderator I got. I got my moderators on here. Let me look. Hi, Monica. Well, welcome. Thank you for being here. Thank you so much for being here. Just give me a few minutes. Just give me a few minutes, and I was just waiting for my other moderator to come in. One of my moderators on here, I just don't see them. I'm trying to see who's here. Hold on, let me look. One of my moderators is here. I just don't know which one is here. Let's look and see. One of my moderators is here. I don't know which one is here. But thank you guys so much for being here. Let's see. got it. Let's see. Hey, Sharima. How are you doing? Hey, Sharima, I need a favor. I don't know whether Just Be Real. Um, I don't know if Just Be Real is going to be coming on this evening because I know she has to work early in the morning. So I need you to look at the comments, and anybody that's disrespectful, anybody that's just saying crazy stuff, just block them from the channel. I mean, monitor it because sometimes people are asking legitimate questions. Monitor it. But if they're being disrespectful, if they're just saying crazy stuff on the channel, just go ahead and just block them. Okay, Sharima? I appreciate you because I don't know where Just Be Real is at, but I'll leave it in your hand, okay? And thank you so much. Hey, Jesus girl Betty, how are you? Thank you for, hey, Danielle. Oh, Danielle here. We got the master moderator. You got my back. I don't know if Just Be Real is coming on tonight because I know she has to work early in the morning. So I'm going to leave it up to you and Sharima to handle my lightweight. Y'all got my lightweight. So I appreciate you guys. Thank you so much. Thank you guys so much for being here. Well, I got some moderators on here so we can have a conversation. So those of you that don't know me, welcome to my channel. My name is Dr. Carmen Bryant. I'm the host of Overcoming Narcissist Abuse. I also do car chronicles. I haven't been doing car chronicles lately because I've been working from my home office, so I haven't been sitting in the car. And so I haven't been sitting in the car. Usually you guys know I do it for my home office too. I do my car chronicles in there. I just haven't had time because as I promised Dr. Hooper, as I've promised, I'm working on launching the first module to the Coaching Institute. So I got my Coaching Institute opening up. So you guys give me a few days and we'll be launching the very first class. There should be 12 modules to the Coaching Institute. And with that Coaching Institute, we're going to be launching the first module. And what I probably will do is do a free Zoom to introduce the course, do a free Zoom. I'm going to create a Facebook page. Hi, Miss Trudy. I'm going to create a Facebook page as I promised. And then, of course, the other thing that you and I talked about, Dr. Hooper, when we were in Dallas, I'm working on that. As soon as I launch this, that's the next project. So I got you. See, I promised. But the thing, what I'm gonna do is I'm probably gonna do a live Zoom, a free Zoom for you all. I'm gonna create a page specifically for the Coaching Institute, and I will do a free Zoom to introduce the coaching program to you. And after I introduce the coaching program to you, I'm going to tell you what is in the coaching program, what I'm going to offer to you, the support I'm going to offer to you, and the launching of the first module. And so you guys will get to come to my Zoom. It will be live. So those of you can be on Zoom and ask questions. And those of you that will be joining me, what I'll probably do is I may just do the free Zoom on the Overcoming Narcissist Abuse page, because what I want to do is reserve the Facebook page for those that enroll in the coaching program so that you guys always have support. Once you start courses with me, you will always have support on that. Be a private Facebook page for those of you enrolling in the coaching program, but the Zoom will give you an opportunity to ask questions as I introduce the courses to you. And so I appreciate you guys for supporting me. So let's get started tonight. Like I said, my name is Dr. Carmen Bryant. I'm the host of Overcoming Narcissist Abuse. Some of you guys know me personally. Some of you guys know me. I'm also a narcissist abuse recovery specialist. There's a new terminology now that has been introduced by Dr. Sandra Brown, who her team has developed the Institute of Reduction of Relational Harm and Education, public education on pathological harm or psychopathy, those that have psychopathy. And I am studying under her at this particular time to get a certification to provide, she said we've met, but to provide assistance with those that have gone through narcissistic abuse relationships, or those that have been in relationships with those with a high level of psychopathy. Some of you guys, if you go back and listen to my videos, I've discussed what pathology is and what psychopathy is. Those psychopaths, psychopathy is a mental illness or mental disease. Pathology is like medical or mental disorders. Those of you understand pathological love relationships. Pathological love relationships are those individuals, and as I said before, this is just education for some of you that are in the field, those of you that have been in situations like this. But pathological love relationships is when a lot of you have been in these type of relationships and you can't just figure out what is going on with this person. Something is not right. Something is wrong. And it's almost like you're staring at them like, what is wrong with this person? I don't get it. And for some people, the old DSM 3, 4, 5, well, now it's the DSM 5, the Diagnostic and Statistical Manual of Mental Health or Psychiatric Disorders. For those of us that are in the mental health field, psychiatric field, psychiatry field, psychology field, that is the Bible of mental health and disorders and personality disorders. And in the new DSM, they're starting to integrate more a broader, dimensional view when it comes to people that have narcissistic personalities or cluster B disorders. Those that may have antisocial personality disorders, those that have narcissistic personalities or borderline, the cluster B disorders, or psychopathy, have high levels of psychopathy. That is not actually a disorder in the cluster B, but it's also a disorder that they're talking about now. Those with psychopathy, mental diseases, mental illnesses, that's where your psychopaths come from. And when you're talking about, when we go to school as mental health providers, just like in the medical field, you go to school to learn how to treat symptoms, manage pain, manage pain, treat, or, in the medical field, manage pain, treat symptoms management. If they can't cure something that they can't find a root to, they kind of give you symptom management and medications. And in the mental health field, we learn the same thing: symptom management, quality of life. We don't ever look at it as curing something, but we look at managing and med management. And so, but what is not normally talked about, which some of you guys have been through, is when you're dealing with in a pathological love relationships, the trauma or the damage done by somebody who has pathological or mental diseases. So that is normally, when we are in the graduate program, that is not normally something that is taught. Usually what happens is when we are in our graduate programs, we're learning assessment, diagnostic, and treatment planning, and we learn some things about domestic violence, and we learn about abnormal psychology or personality disorders, but it does not go in depth teaching us how people that have personality disorders or people that have a high level of pathology, how they affect the loved ones that they're with, how they cause traumatic injuries to individuals that are involved in the relationships, how they have traumatized people. And I've said this before, please understand, this is I just want a disclosure, to make sure that you understand that I am a licensed mental health professional, but I am not your therapist. I'm a therapist, but I'm not your therapist. So please follow the advice of those of you that have psychiatrists or psychologists. Don't run in there and say, Dr. Carmen said, and this is what they said, and I don't have this. I knew I didn't have this disorder. I did not say that. Disclaimer, make sure it's out there in the world wide web and social media, that I am telling you to stay with your professional provider, your med provider, your therapist, whoever your therapist is. This is for information purposes only. But what the Institute is teaching, what Dr. Sandra Brown is teaching is that, we're being trained. A lot of training comes outside of the graduate program. And what we are learning now is, first of all, most people, and I taught this in the very beginning too, because this is what I learned. This is not taught in school. This is what I was learning. And what I was learning was, and from some of the clientele that I had, that a lot of the people that had narcissistic personality disorder had trauma in their life. They did have complex PTSD. They did have trauma. They came from traumatic backgrounds. They were abused in every which way: neglect, rejection, abused, even violated. But now we're finding out through all these over 30 years worth of study that number one, when they did an fMRI or MRI, they did the brain scan, they found that a person that has NPD, their brain is actually very different than the average common healthy brain. And so you can look at the x-ray. Some of you can look it up if you want to. If you look at these MRI pictures, if you look at a person that has dementia, you have a person with autism, you look at a person that has narcissistic personality disorder, their brain is actually different on the imagery than it is on a normal healthy brain. So that's one. Genetics played another part. When you talk about their social environment, their environment played a role in it, but also, neurology. Now we found that neurology plays a large part in that. And so that lets you know that there's something really wrong with this individual. And because there's something wrong with this individual, there is something really wrong with their personality. They have a personality disorder. That's what it tells you, a disorder. What happens is most of the time what's not talked about is how a person that is disordered affects a person that they're with, whether it's a loved one, whether it's the children, because children are affected by this individual, loved ones, husbands, wives, mothers, fathers, whoever is in a relationship, intimately relationship. And sometimes it may not even be an intimate relationship. It could be a work relationship. Some of you guys got narcissists at the job, and how they traumatize you. Most people don't realize that a lot of disorders, they're also finding out that a lot of times when people are being diagnosed with different disorders, a lot of those disorders, they don't take in consideration. They could be trauma disorders. And so there are a lot of people, and like I said, this is where that disclaimer comes in. Please stick with your mental health provider. This is for informational purposes only. But a lot of times what I have found is that people that have symptoms of ADHD, now, true enough, you can have ADHD and PTSD and complex PTSD, complex PTSD, you can have those at one time. That is true. But a lot of times, people that have attention deficit hyperactivity disorder or attention deficit hyperactivity disorder that's combined with the hyperactivity or just attention deficit, that means you don't have the hyperactivity. But a lot of people that do have ADHD or ADD that hey, Just Be Real, thank you so much for being here. Thank you so much. I called, but I wasn't sure if you were sleeping. I want to respect your time. Thank you so much for coming in. But what they found is that a lot of times, and what I found is because I've had to go back in and do an assessment to determine, it's like diagnostic verification. And whenever I get people in, a lot of times, unless they have records already, I like to see what the diagnosis is itself to determine whether it's trauma related. And I do take, when you're talking about a trauma professional, I got the dream team in now, the moderators. But what I find is that a lot of times their past and their trauma is not taken in consideration. And sometimes, for the purpose of billing, those of you that deal with billing, medical claims and things like that, they know that they need a diagnosis in order to do billing or med management. And a lot of times they have been misdiagnosed, not on purpose or not out of negligence, because a lot of times people don't have, they're not going to sit there. And, when you're talking about med managers, they're not going to sit there and just take a whole bunch of information. They do the charts, they ask you questions, they look at the symptoms, and then they treat according to the symptoms. They treat according to the symptoms until you get to someone like a mental health provider that is trauma informed or trauma trained. And we, especially dealing with narcissist abuse and how it affects people, we go in and we go more in depth to find out, is this a trauma related disorder? And what I have found for some people that are being diagnosed with ADHD, sometimes that medication doesn't work like it's supposed to. Sometimes it does a little bit. But what happens is I find that sometimes this is not ADHD. And the symptoms, though they look very similar, I actually found that it was complex PTSD. And a lot of this came out from the training that I've been through and what to look for. And so there are some people that are being misdiagnosed, like I said, not on purpose, because if you're not trauma trained, a lot of times you don't know specifically things that you're looking for. And there are some people that have been diagnosed with ADHD that actually have complex PTSD. There are some people that have been diagnosed with bipolar disorder and they have complex PTSD. There are some people that have been diagnosed with bipolar disorder and actually have borderline personality disorder, which is also kind of a trauma related cluster B disorder. There's a high percentage of people that do have borderline personality disorder that also have narcissistic personality disorder and reverse. That's why they're called cluster B disorders, because there is a kind of the kind of a lack of better words at this particular time. There's kind of because it's cluster B is kind of the symptoms all run into each other. That's why they're called clusters, because a lot of those symptoms run into each other. And this is why I was saying with the DSM, at one point in time, it was a categorical view. Categorical view, and that's why a lot of people struggle that have been in relationships like this. People struggle because they're trying to categorize their loved one into a specific category of personality disorder. These symptoms fit this particular disorder. If they don't have these particular symptoms, then it's not this disorder, then it's something else. Well, the dimensional view, which is now what is being taught with the DSM, is more of a dimensional, meaning a broader view. Most people that do have the cluster B, or specifically narcissistic personality disorder, have other disorders to go along with it. That's why it's so complex. And those of you that have been in pathological love relationships struggle because I told you guys, hope is the last thing to go. You always, when you love somebody very deeply, you always want the best or hope the best. And a lot of times the problem comes with that denial that I just don't believe that this person can possibly have NPD, because a lot of information is going out. And so there's a stigma that goes along with it. And so for most people, they're in denial because I really love this person. And, on the good days, they're good. And on the bad days, they're bad. Let me explain something to you. You have to remember, on the good days, they're good, and the bad days are bad. That's because of the fact that you're trauma bonded and you're being trauma bonded. Another hard thing to have to come into reality is when you have grown up with family that you love. And when you have grown up with family you love, or those of you that have been, married to a person that seems just so is strange, it's so strange. Hold on just a minute. Make sure nothing crawling on my leg. I felt so I almost tore down all these cameras, y'all. Almost tore all these cameras down. Felt something crawl on my leg. But a lot of times also when you have grown up in your family, your family of origin, you didn't know information like this. Now that you're older and you start looking like at your siblings, at your mother, at your father, and some of you are starting to look at, the person you were married with, even if you divorced them, and you start looking at them based off of, what you have been learning, and you're starting to put them, you're starting to look at these symptoms, or you're starting to look, and the reason why I try to come on, yes, I can speak clinical for a lot of people that are in the clinical field. It is easy to have that clinical language with people that are in the field of medical or mental health. But, can you take that information and translate it in layman terms to the average person that is listening that is not in the field? And I try to do my best to try to interpret that in common language where you can understand it by giving you examples of behavior. So if you look at my channel, a lot of I use sense of humor because, humor is laughter is good for the soul, especially when you've been hurt. And so when you look at my channel, a lot of information that I provide you, I give you a lot of analogies. I give you a lot of examples of what the behavior may look like. And yes, you can laugh, but sometimes you laugh to avoid from crying, but one of the things that I want to say is you're looking at family now, and one of the heartaches is when you feel like you're being pushed out the family, or when you feel like your family doesn't love you, or when you feel like, I just don't understand why they treat me this way. Why does my mother treat me this way? Why does my sister or my brother treat me this certain way? Why does my father treat me this way? Why is it a love-hate relationship, with these family members? Why do they treat me like I'm the black sheep of the family? Why do I never get credit? I think my little internet. Give me just a minute. Let me check my internet. Y'all give me just a second. I know you guys are on YouTube. Give me just a minute to check my internet, okay? Hold on just a minute. Just a minute. I think over here on Facebook is glitching. So let me see. I think my Facebook is glitching, y'all. Let me see if I take it off of here. Let's see what happens if I take it off the internet. See if it works. Just be real. Can you look on Facebook to see if I'm frozen? Because I think the internet is glitching. I don't know why it's glitching, but I think it's glitching. Let me see. Yeah, okay. Miss Shirley said I lost Instagram. I lost Instagram. Instagram is back on. So I think okay, there we go. Facebook. Oh boy. I think my Facebook is cutting up. Okay. I think we're back on Facebook. I apologize. I think the internet was glitching a little bit. Okay. I think Facebook is back. Facebook is back. Instagram is back. Okay. Where did I stop? Okay. Okay. Thank you. A lot of times you're looking back in your family now and, you're looking in your family now and you're beginning to, and that's the hardest thing, to look at family and say, no, this is not possibly true. This is not true. This can't be true. You know, my mother, my sister, my brother, this can't be true. You know, this can't be, but you just know that that something is not right. Why do they treat me this way? You know, when a person is abusive, when a person is verbally abusive, when a person is like they hate on you. You know, it's like they're haters. You know, they hate on you. You know, you do as much as you can to love on them, but they always mistreat you some way or another. They always mistreat you. They don't applaud you. They always have something negative to say. There's no pat on your back or anything, and you start looking like something is just not right. That's a hurtful feeling, you know, to come to realization that something is really wrong. And some of you now are beginning to see that this behavior is, you know, when a person mistreats you, it is what it is. And one thing that I can't stand when I hear this, this is one thing I cannot stand. The one thing that I can't stand is when someone says, especially when I'm talking to women, you know, thank you. You know, one thing that I say, give me 30 minutes. Well, I've been on here. How long have I been on? Just be real. But one thing that I can't stand is, but he's a good father. You know, yeah, he may have, you know, done this and this to me, and yeah, and me and him just couldn't be together, and it just didn't work. In some situations, that's okay. You know, we just didn't get along. We didn't get along. But when that person is abusive and verbally abusive and treats you with disrespect and does it in front of the kids, one thing I can't stand is for someone, whether it's male or female, to say, but she's still a good mother, you know, but he's still a good father. Now, we need to take that into account, because if they're mistreating you, if a man mistreats you, ladies, you know, what type of example is that setting for your sons? What type of example is that setting for your daughters? Because when they leave out of your house, they gravitate what they're accustomed to seeing. They gravitate either to a man that's abusive, or they become the abuser. They gravitate to a woman that's abusive, or they become the abuser. You know, and one thing that I can't stand is a woman that just disrespects a man, especially, and thinks it's okay to because she thinks that she's in control, and so she does that in front of people when they totally disrespect a man, or I can't stand that. And these women think well, you know, he ain't going nowhere, and he paying my bills, and da 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 da. You know, but to disrespect a man, that's a king. You know, I know some of you guys, I'm old school. I know some of you guys, you know, this is a democracy and we're not into, you know, whatever, but a king is a king, and you respect him. You know, you respect him. He should respect you likewise, but you're still responsible for your actions. And men, you know, to disrespect a woman, to abuse a woman in front of her children and spend in front of your children, you know, that makes you have to go back and say, is he really a good father? Is she really a good mother? Because you have set a standard, and when they leave your home, they gravitate to what they're comfortable with. A lot of you have been abused, misused, you know, and what happens is you wonder why you always get into very similar situations. Number one, you didn't take the time to heal. Number two, most people, when they have not learned about abuse, misuse, and self-confidence, learn to heal. 15 minutes. Okay, give me 15 minutes. Okay, give me 15 minutes to make it a complete 30 minutes. But a lot of you that come out of these type of households, and this is the example that you have, you know, a lot of you gravitate, even though you don't like it, you gravitate toward what is your norm. You gravitate toward what, you know, if no one has told you that Dr. Hooper said men need respect. Anything less is unacceptable. Y'all heard it from a king. Y'all heard it from a king. You know, there's one thing, you know, a man will tolerate a lot. But when you disrespect him, hold on. Y'all didn't delete Dr. Hooper, did you? Did y'all delete? Hold on. Y'all don't delete Dr. Hooper? Y'all didn't delete Dr. Hooper, did you? No. Don't delete Dr. Hooper. Y'all go back and look at Dr. Hooper's comment and bring him back on here. No, that's my friend. Don't delete Dr. Hooper. Y'all go back. Who just deleted his comment? You got it? No. Dr. Hooper, don't delete him. Hold on. Who put him on timeout? Who deleted his message? Dr. Hooper, are you still there? Could you please say something? Oh, okay. Cause your message was okay, Just Be Real took care of you. Okay. Oh no, don't block him. Okay. I don't know if any of the other moderators, well, I know Danielle didn't. I don't know if Sharima did or not. Don't touch Dr. Hooper. Yeah, don't touch him. Okay. Thank you. I appreciate it. Oh, but no, that's a king, because let me tell you something. A man will put up with a lot. But when you start disrespecting him, a man will go out. Tell me I'm lying, Dr. Hooper. A man will go out to get a loaf of bread for 50 years. That man been going to get that loaf of bread for 50 years. You ain't seen him in 50 years, and he's still going out there. Oh, okay. So, Dr. Hooper, if your comment was deleted, they put it back on there. They didn't mean to touch your comment. They meant to get the guy that was under you. So our apologies. But, you know, if you disrespect or dishonor a man, that man will go out there to buy a loaf of bread, and he been going to buy that loaf of bread for 50 years. You ain't seen him since. He went out to get a pack of cigarettes. He's still out there getting a pack of cigarettes, and it's been 50 years. That man still hasn't returned back with a pack of cigarettes. And you know what a woman needs, ladies and gentlemen, you know what a woman needs is a woman needs to feel secure. She wants to feel pretty. She wants her man to make her feel pretty. That girl can look like, hold on, a mud duck. That with an alligator face. Like my mom always says, that woman can have an alligator face. She can look like a mud duck. She can look like an ostrich. Oh, thank you, Danielle. I appreciate it. But they can look like a mud duck or an ostrich with their head stuck in the ground. But that man can tell that woman that she's the most beautiful thing in his life. He loves her, and the most beautiful. That ugly mud duck, you can't tell her nothing after that. You can't tell her nothing, because if a man told her she was beautiful, that woman feels beautiful. There's nothing you can say, because that man gave her some confidence. And let me tell you this right here. Do you know, ladies, that your confidence actually comes from your fathers? So if a father was not there, or a father figure was not there to make you feel like a pretty little girl, or to boost your self-esteem, women can do an awesome job with women. Yes, they can. We can raise up some very powerful young women. But when a man tells his daughter that you're powerful, that you're beautiful, you know, that self-esteem comes from the father. That's how relevant father and father figures are in a young woman's life, you know. And then when it comes to boys, ladies, you can't just talk to them boys any kind of way because a man has hurt you. You can't just talk to them boys and make them pay for what that man has done. And then you a big mouth woman talking to this young boy any kind of way, and then you wonder why when he gets older he talking crazy to women. He has no respect for women whatsoever. A lot of that comes from the home. But what happens is as they get older, they gravitate. It's not that they want to be there, but they gravitate toward what is their norm, what they grew up with. Not only do you gravitate toward what your norm is and you don't like it, what happens is when you lived in a household that was chaotic, and when you have lived in a household that is abusive, what happened is a lot of you have learned how to walk on eggshells. You have learned where the booby traps and the landmines are in your home. You have learned when he comes home or when she comes home, I can tell by the sound of her voice or the way that they open up the door or the way that they pull up, I can tell. So you have learned to maneuver and survive in your own home. So what happens is when you go out into the world and you meet people, is not the fact that you want to be in that situation. That's just how you know how to maneuver in them landmines. And so you gravitate back because I know how to maneuver in there. I know how to walk on eggshells. I know how to pull back. I know their voice inflection. So when something good comes to a lot of us women, when something good comes to a lot of us women, we don't know how to handle it, and we're defensive. And to be defensive, constantly defensive mean that you're not trying to defend your heart. You're trying to protect yourself. And so what ends up happening is you can hurt a good man because you are always on defense. Dr. Hoop said he wants respect, woman. Hold on. He wants respect, women. Then he becomes mentally abusive. There you go. See? And that's coming from, ladies, a lot of times we give advice, on behalf of men, but when you listen to men tell you how men think, because women don't think like a man, but when you have been in a war zone for so long, that's all you know is war zones. That's all you ever know is a war zone. She said, walking around landmines, living with an alcoholic parent. See? So when you get into a relationship with someone or situationship with somebody, all you know is how to walk around and maneuver around landmines. And that is your norm, even though you don't like it and you're complaining about it. So when something peaceful come around, you don't know how to handle it because I don't know what to do unless he's calling me names. I don't know what to do, if they're not calling me names or, because I don't know. And sometimes what happens is you self-sabotage. You blow the bomb up. So you create some mess because I know how to maneuver in the mess. Do you know that there are so many people that have gotten out of these situations? They get into their own peace and quiet, their own apartments and peace and quiet, and they don't like to be alone. I don't like the quiet. Is tormenting. I can't be by myself. The quiet is too much. And then they're having panic attacks and they're having high anxiety. You know why? It's because a narcissist, toxic individuals or narcissists usually are tormented by peace and quiet. They're tormented by your peace and quiet. That lets you know that every fight is not your fight. You ain't got to argue with everybody. There's some arguments that are not even worth having. There's some things don't even be drawn into because a narcissist, they'll draw you in, they'll bait you in so that you'll argue back and forth. And when you argue back and forth, you're giving them the ammunition to know how to fight you, And so when you are at peace and quiet, a lot of times you're at peace and quiet because you know that narcissist was not going to let you be at peace and quiet. There's always something that happens to disrupt, your peace and quiet. They're always doing something because misery loves company. A person that's chaotic on the inside, they're going to cause chaos wherever they go. And some of you are so accustomed to that you don't know what to do without the chaos in your life. That's why you can't be at home by yourself. You can't be in peace and quiet. Peace and quiet is too loud, too tormenting for you. And it's like you're waiting for the shoe to drop. You're waiting for the next thing to happen. I'm panicking because something's going to happen. Something's going to happen. No, they got you thinking something's going to happen and nothing's going to happen. Another thing that I wanted to talk about is, what happens when, a lot of you come out of these situations with these narcissists and you want to go back and date. You know what I mean? You want to date, but you haven't taken the time to work on yourself, right? And some of you feel like I'm good. And some of you, may have healed to a certain extent. You may have. And the one thing you have to understand that in your healing, you've done well in your healing. You're feeling good. You're feeling confident. You think that, you may feel like I'm ready to date. I'm ready to be with some. Understand that there are some triggers that don't come out until you actually connect with the person you're supposed to be with. Now, for those of you that have been in toxic relationships, Dr. Hooper says some people live in confusion so long until it becomes a norm for them. You must learn who you are. Bingo. But sometimes what happens is, and a librarian says sometimes working on yourself takes time. There you go. See, sometimes we're so used to being in a relationship that you don't know what it's like not to be in a relationship. So you want to be in a relationship, but you never taken the time to rebuild yourself, to work on yourself, to learn how to be, in peace and quiet. What color do you like? What foods do you like eating? Do you like eating alone? Do you like go out to a restaurant by yourself? Go take yourself to the movie. Go sit by the water. Go lick a window and be happy and smile. Go sit in your backyard. Read a book. When was the last time you read a book? You know what I mean? And then, believe it or not, and this is something that my mother talks about all the time. My mother, my big sister, Bishop Kathy Gibson, and my mom, Helen Sadler, your destiny helper. A lot of you guys know her. You know her as Apostle Helen Sadler. But a lot of times, when you get with the person that you're supposed to be with, a lot of times, you are healed. It feels good. Hey, Valerie, you feeling good. That's that honeymoon season. But what happens is that there are because when you are in a relationship, you have to be vulnerable, right? So this is the difference between a narcissist relationship and a general healthy relationship. Number one, 7 minutes. Okay. Number one, you have to understand that there are some vulnerabilities that you don't share with anybody else except for the person that you're going to be with and be intimate with. When I say intimate, I don't mean sexually intimate. I mean intimate, sharing intimate thoughts, having intimate conversations, getting to know each other, building rapport. And in that relationship, you're learning boundaries. You're learning what he likes. You're learning what she likes, what they don't like, what their limits are. And out of love, they'll teach you. I'm going to teach you. I'm going to train you what I don't like and what I like, so it's that mutual respect back and forth. I don't like to be called this. I don't like, please don't do that. Next time you get mad, please don't do it like this. Please, let's make an agreement, so you are learning the dance of relationship. You're learning that dance of relationship. And in that dance of relationship, I need to know what your boundaries are. You need to know what our boundaries are. Have you ever seen them older people, like people that have been together 20, 30, 40 years? They know how far to go. And when they run up on that boundary, they back up. The person don't have to say nothing to them. Like, no, I don't do that. No, we don't do that in the house. He don't don't do that. Don't do that. I'm telling you, if you do that, you're going to get an earful. She don't like that. I'm just letting you know ahead of time. Please don't do that. Don't do that. I'm just letting you know ahead of time. And them older people, how they finish each other's sentences and stuff, that takes time, right? And when you are building a relationship with someone, you don't fall in love with nobody, because if you fall in love with them, you can fall back out of love, right? But when you're building that relationship, when you are in a relationship, and a healthy relationship, there are some triggers that you don't even know still exist, and some wounds that you don't know that are still there until you get with this person. You have to be vulnerable with this person. There are some, and just like my mom said, there are some things that don't come out and is specifically assigned to the person that you are with in a healthy relationship. Because when you have that trigger is an indicator that that's an area that has not quite healed yet. But you're not going to have that come out until you are in a relationship with someone that you love and loves you back respectfully, right? And some of those don't come out. Some things you thought that you've gotten beyond that is tested in that relationship, but you have protected yourself and protected your heart, where you could have been single for 20, 30 years. And when you get with this person, that person is going to push all those buttons. And this is where you two learn and grow together. Now, that's a healthy relationship. In a narcissistic relationship, a narcissist, when they get with you, everything moves very fast. There is no getting to know each other. There's that honeymoon phase, or that trauma bonding, or that idealization stage. And in that idealization stage, they're not getting to know you and building rapport. What they're doing is they're interrogating you. They need to know what your weaknesses are. And you think this person is such a great conversationalist. They really, they listen. They're all into it. They have so much empathy. No, they're listening to you, because what happens, women, we talk too much sometimes. Sometimes we just talk entirely too much. And what you do is you start giving them a script. Men, sometimes you do it too, but you start talking and you lay out the script to your life. So you lay out the movie script, and that narcissist, he determines, or she determines, what role I want to play in that movie script. I'm going to figure out what role to play. You don't like when people don't look at you in the face when you're talking. You don't like when people get mad and just give you the cold shoulder or give you the silent treatment. You don't like for somebody to walk off while you're talking. You don't like this right here. And one thing that you can't handle is, and one thing that I don't like, and this is, why are you telling him everything that you don't like? Let him discover you. let him discover you. Men like the pursuit. Men like the hunt. Those are lions. And when you take the hunt away from a lion, some of you women, y'all can't be so desperate. You turn around and you start hunting a lion. They make them, then you got those lions that are over in the zoo that don't know how to hunt anymore. They laying around, they throw the meat and they laying on their side, eating the meat slow. No, you want one of those robust lions, real men, and a real man likes to hunt. Don't take the hunt away from him. And you shouldn't have to tell him everything. That's why the man should discover you. And you should not talk so doggone much. You giving him the script and telling him the role. Yes, love is a choice, not a feeling, ladies. Gentlemen, love is a choice. Love is not a feeling, because feelings go away. But when you make a choice to love someone, you're making a choice to do right by them. And narcissists are not like that. Narcissists, it's a one-sided relationship. They need to know what role, and what they do is they listen to you and you tell them all your weaknesses, the things that we consider love and beautiful, they consider a weakness. To love you is a weakness. To share emotions, to have empathy is a weakness. You see what I mean? And the thing about it is, a narcissist takes what is your vulnerable things, and it's your kryptonite. So what happens is when you spill the beans, like those of you that are Bible scholars, like Samson, he told Delilah, eventually she kept nagging and told him that if you cut my hair, I lose my strength. And so what happens is you tell that narcissist your weaknesses, and guess what they do? They cut your hair, because it's a power and control thing. They want to dominate. They want you to make them number one in your life. They want to isolate you so that everything that they want you is like the pharaohs. They want to be the pharaoh in your life. They want to be the God in your life. Everything that I say goes. When I say something, they're dominators. They come into a room and take the air out of the room. You have plans or something, like they come in and change all the plans. They have most of you guys experience it. It don't even matter about you. It doesn't matter about you. It's what I want. And if you give them a crazy look, if you don't really know them yet, they may switch it up a little bit, but a narcissist want to dominate. So your conversation, when you talk too much, a narcissist takes that as your kryptonite. They use that, and later on within the relationship, they'll use that to punish you. It's that positive and negative reinforcement. If you don't do what I say, then I'm going to punish you by ignoring you. Everything that you told them that you don't like, or everything you told her you don't like, if you don't do what I say or do it the way I say, and I have a temper tantrum because they have arrested development, they have not developed their emotions, and they don't have responses, they have reaction. I don't get what they want, like kids, they have temper tantrums, but they have grown people temper tantrums. And if I can't have what I want, I'm going to punish you by everything that you told me that you don't like. I'm not going to call you. I'm going to ghost you. I'm going to make sure I ignore you. I'm not going to look at you in your face when you're talking. I'm not going to pay no attention to you. Everything that you told them that you don't like, they did it in order to pull you in. And that's my soulmate. And oh my gosh, this person loves me. And they do all this. No, they're playing a game to pull you in. That's the bait. Then when you're in the situationship or the relationship, that becomes the punishment to reinforce what they want. So what it is if you give me what I want, I'm going to reward you with everything that you say that you hate for a person not to do. So I'm going to give you my time. I'm going to give you attention. I'm going to overload you. So there's no middle ground for them. I'm going to overload you with this. So you just, oh my gosh, this is great. Oh my gosh, I want more. It's like a drug addict. I want more. I want more. Then when you don't do what they want you to do, you'll notice they'll suck it back. They'll take it back. And that's your punishment. A lot of you don't think of it like that. Even your daughter, Miss J say, kids are like that. Brothers and sisters are like that. I'll punish you and not talk to you. And now some of you guys have gotten wise enough to know if they stop talking to you, you happy. Good. I'm glad they mad at me. I ain't got to talk to them. Some of you guys are still in the relationship and you glad, or some of you guys are divorced from that individual or not even with the individual anymore. And the minute they decide, you may have kids by them, the minute they decide to punish you by giving you the silent treatment, you like, thank you. Finally, they are dominators. They'll come in a room, everybody's happy, go lucky, but guess what? But the attention is on somebody else. And so if the attention is on anybody else, they come in and got to get the attention. They'll suck the air out of the room. They'll turn it around and make it about themselves. Kids going to school, graduating from college, getting married. They're going to find funeral. They're going to find a way to turn the situation back to themselves. They crying extra hard and don't even know who being buried at the funeral, but they crying extra hard. And they start crying extra hard to a point. I met them one time and they were such a wonderful person. I can't believe they're going like, how long you been knowing them? I've only met them one time, but they go overboard. And there's another thing that a narcissist do. Have you ever noticed? Now, some of you may have experienced this. Like, say someone in the family has passed away, right? And so you don't even talk to them. You're divorced from them. Kids are grown, or you may have kids. You don't even talk to them like that. You practice gray rocking. You have to talk to them because of the child, but you limit so you're doing a great job. And the minute something happens in the family, someone dies, they use that as an excuse. There's always an ulterior motive. They use that as an excuse to reach back out and let you know, hey, mama passed, my daddy passed, so-and-so passed. I just want you to know because I know that you were close with them. So what they're waiting for you to do is call them up. Oh my God, when did this happen? Oh my God. And you feel bad if you don't. I feel bad. I know they're narcissists, but they did just lose their parent, and it's not right if I don't. They don't care. That right there is just, it's an ulterior motive. It's all about them. They don't care. They lost a supply. So if you see them crying, it's probably to get some empathy and emotion from you. And if you see them crying, they don't lost a supply because I haven't figured out how to replace that one yet. But a lot of times that crying and acting a fool and oh my God, I don't know what to do. And I know that me and you don't get along and I understand it. And please forgive me. I just know that you're always there. There's always an ulterior motive. And so it's one of those situations. I feel bad. My condolences to you, and leave it like that. Because a lot of times they're also looking to see how they're supposed to react because they're not sure how they're supposed to react. So it depends on how you respond is how they're going to react. If you, oh my God, oh my gosh, are you okay? Oh my gosh, I can't believe this. Oh, I got to hype it up. Oh my God, I know I feel so horrible. Oh, they just play it, and you just feed into it. But when you monotone and you really don't play into that, and they call you and they let you know, you're like, you know what, my deepest condolences to you. Gray rock, there ain't no emotions involved. My deepest condolences to you. I know you're probably hurting. My deepest condolences to you and your family. That's too boring. That's not enough energy for them. You didn't feed into their ego. You didn't make them feel no better. So they got to find somebody else to do it. And so whoever they find, if that person hypes it up, they play into that. Isn't that sad? How exhausting is that? How exhausting is that? And the sad part about it is a lot of you guys think you haven't ran into a narcissist, and some of you guys have narcissist family members. And when I say, I don't mean narcissistic, meaning the traits. Some of your family members are narcissists, and the sad part about it is they've been hidden in plain sight. They've been hidden in plain sight, and you didn't even know. Now you look at your family and you're almost shocked. Now you start to understand why they acted the way that they acted. Why they acted, the way that they acted. Why were they treating me this way? It doesn't mean that there was something wrong with you. When you're dealing with a pathological person and you are in a pathological love relationship, remember, you are affected by who you are connected to. And that's positive or negative. And when you are with a person that has a personality disorder, and especially if they have a high level of psychopathy, meaning mental disease or mental illnesses, that the way that they think and the way that they behave causes trauma. It's inevitable that when they connect with a person, family member, or get in a relationship, they're going to cause trauma in your life. Some of you guys got migraines. Some of you got nerve issues. Some of you guys have neurological problems in your back. Some of you guys have fibromyalgia. Some of you have fibroids. Some of you guys have all sorts of gynecological, that word, issues. A lot of you guys have reproductive problems, fibroids, all sorts of problems, things in your body, things going on in your body. Some of you guys are actually losing hair. Some of you guys, hair is thinning out. Some of your hair is thinning out. Some of you guys, gray, all of a sudden, premature gray. You ain't even supposed to be gray, got gray hair. Some of you guys got vision problems. Some of you guys just nervous all the time, always anxious. Some of you guys have heart problems, heart conditions. Some of you guys actually have PTSD and complex PTSD. Some of you guys got heart condition, breathing problems. Your immune system can't even regulate itself and fight the common cold, weight gain, because of the fact that your immune system is so jacked up by trauma. And this individual, and some of you say, but he or she has never put their hands on me. But do you know how much medical and psychological is connected? That if you are traumatized, emotionally traumatized over and over and over again, it causes brain damage. Some of it is repairable, because if you get out of it enough, it'll start regulating itself. Autoimmune disorders, absolutely. But some of you guys that have been in long term for many, many years are actually talking about that brain fog, memory, heart failure. Danielle, hey, my girl, my sister, under so much pressure that she ended up having heart attack, strokes. Let me tell you something. Please delete his promotion, because he did not ask for permission to promote himself on my page. So please, wherever he has promoted himself, please delete that. Thank you so much. But yes, but do you see that these individuals cause trauma in your life, and there is an effect. It's inevitable when you deal with a pathological love relationship. It's inevitable. You will be traumatized. You will have trauma disorders, and some of these disorders that you have may have been misdiagnosed. You may think you have ADHD. You may think you have bipolar disorder. You may have trauma-related disorders like complex PTSD, anxiety, depression, all sorts of stuff. Somebody just has to take your history. And like I said, as a disclaimer, I'm a therapist, but I'm not your therapist. It's for educational purposes only. And the thing about it is, you have to make sure that you talk to your provider. Hazel Miller said, I'm wearing a wig. Girl, I love me some wigs. I told you, fall is coming around. Pumpkin spice lattes, orange colors with the autumn leaves. It's my favorite season. Fall and winter is spring, fall and winter. Fall is my favorite. And I love me pumpkin spice. I love me orange colors and wigs. That's what we do. But let me, I know the 15 minutes is up. I did a lot of talking. So what I would like to do is just open it up for 10 minutes. Ask me some questions related to what we were just talking about. And just let me know if you have some questions about the topics that we were talking about. I know last time some of the questions were just off topic from what I was talking about, but please, yes, sweater weather. Hey, Shanti. Yep, sweater weather. I like me some old sweater. Now, I like summer. It's okay. Favorite season, spring. My favorite in the whole world, fall and winter. My favorite is fall. I love me some fall. But ask me some questions. Ask me a question. Tell me if you want to ask me any question. Well, ask me some questions. Talk to me. Ask me some questions. And I love the Christmas holiday season, because it's like the earth takes a break. And those of you that are over there by the snow, oh man, I love it when we snowed in. That doesn't happen too often, but I love it when we're snowed in and you just get to have a fireplace, get to sit in front of that fireplace. Sometimes I have to make myself not work and just sit down and enjoy the moment. So you guys take and enjoy the moment. Jesus Girl Betty said, can you describe a mood disorder? Well, bipolar disorder is considered a mood disorder. And sometimes when it's not definitive, meaning if it doesn't just fall correctly into that category, like when they do the assessments, 10 minutes and questions need to be brief. Thank you. But mood disorder, a lot of times, when you're dealing with mood disorders, you're dealing with mood disorders. You can't regulate your mood. And sometimes they can't, sometimes it's none otherwise specified. It doesn't fit directly into that category. So what they'll say is a mood disorder, because your moods are up and down. And so sometimes what happens is you get medication, and the medication that you get is, what is it called? Oh my gosh. You get it with bipolar disorder a lot too. Mood stabilizers. A lot of times you get mood stabilizers. Well, hey there, Miss Ernestine. Miss J say, for me to answer that question, you would have to have an appointment with me. That's a whole segment in itself. But how do you handle your daughter? That would be a one-on-one session with me to have to explain that to you, because I would need more background to that. And that's really a session. That is actually a session to educate you about you and your daughter and what to do. You are so welcome. Do we have any more questions? Anybody else want to ask me more questions? Ask me a question. Ms. J says she's a mental health provider, and I feel as though she plays head games. She probably do. There's a lot of people in our field that actually are narcissists, or are narcissists, and they like the control that they have within a mental health setting, because the average person that comes to see us, expect us to have answers to help them. So it's easy to get in a position, for a narcissist to get in a position of mental health. When they get in a position of mental health, they feel empowered because they feel like people that come to them are weak. And please know, when you go and to a mental health professional, that does not make you weak. There are people that come to me maybe once or twice a year. They have these very high impact jobs. CEOs, they have very high impact jobs, and they just need someone to bounce ideas with. They need someone to talk to try to stabilize themselves. For those of you that are in the state of Washington, I am licensed in the state of Washington. So the only sessions that I can provide is if you are in the state of Washington. I have a license pending in the state of Texas. And so I should be within the next 30 days, but I have to apply for all the insurance boards in Texas. But within the next 30 days, I believe I should be licensed in the state of Texas. So right now I'm only licensed in the state of Washington. So if you are not in the state of Washington, I cannot provide you with therapy. But that's right, Dr. Hooper, wise counsel, exactly. But I am in the state of Washington. So I can only, those of you that are in the state of Washington, that's the only place that I can provide you with therapy. Within the next 30 days, I should be licensed in the state of Texas, and I will make sure to let you know. You can go to Psychology Today and look at the therapists in your area, whether they do it online or in person, and what insurances they accept. And you can also go to BetterHelp, and you can use my name as a code, betterhelp.com/Dr. Carmen, and they'll give you a discount to see therapists within your state. 5 minutes? Okay. Within your state. You said, where do they learn this silent treatment? I asked who taught you this. They learn it from you. They learn it from you. They learn that it hurts, so they do it. And then what do little kids do? When they get mad, they throw their arms across their chest and won't say anything. So a lot of stuff that they do is stuff they learn in childhood. And they also learn what it is that hurts you. So if that hurts you, that's what they'll just do more of. And when they find out that it hurts other people, I mean, that is now a weapon that they use, So if it hurts you a lot, that's why they do it. So it's one of those gauge games. Let me gauge and see what it is that hurts you the most. And whatever it is that hurts you the most, I'm going to do it the most. I'm just going to keep doing it. I analyze things too much every day, all day. What can you tell me, please? You need to go find yourself a therapist. Go to Psychology Today and go find yourself a good therapist in your area to help you. Hopefully a trauma professional if you've been traumatized. But Sylvia, you'll find yourself a good therapist that can help you. Let's see. How does a person know when they're completely healed and ready to move on into another relationship? I don't think you're ever completely healed. You're going to be going through a healing process, but that does not mean that you can't be in a relationship. And when you are desperate to be in a relationship, that's not the time to be in a relationship. And you have to ask yourself, why do I want to be in a relationship? I'm tired of paying bills by myself. I don't want to be lonely. I don't want to be by myself. Those are not good reasons to want to be in a relationship. when you want to be in a relationship is about purpose, and I understand. Now keep in mind now, understand that I'm a Christian. I'm a believer of Jesus Christ. And so my opinions, are just that, my opinions. If you ask me, I'm gonna give you an opinion that's biblical based, and I understand that a lot of people are not, Christians, or not believers in Jesus Christ. You have your own thoughts about relationships and how to do relationships. I can only answer the question based off of my belief system. And one of the biggest things, and a lot of my sisters and brothers that are on here, we kind of run in the same circle. And you have to remember that in the way that I see it is that when you are desperate and you desperately want to be in a relationship, there's nothing wrong with having a desire to be in a relationship. We're not supposed to be by ourselves, and if you have a desire to be married, then that's a good thing. There's nothing wrong with that. That's a healthy desire. You want to be married, you want to have a partner, a best friend. I look at it as if I get in a relationship, I want the person to be my best friend. This is my last relationship. This is the person I want to be with for the rest of my life. I made some mistakes. You have to think of that. I made some mistakes in my life, married the wrong people because I was doing all the wrong things. But now that you're mature, or now that we're mature, this is a partnership. This is, it's a ministry. Some of you guys know it's a ministry. Marriage is a ministry all by itself. That partner supporting you supporting that partner. There should be some type of connection. You can't have a person that you two totally opposite, have no interest, you can't even connect, But one of the biggest foundations, the base to it, is becoming friends. What happened to friendships? You build a friendship, you build a relationship, it's a foundation of friendship. Do we have something in common? Can we have a conversation? Are you interesting to talk to? Where are you going? Or do you have plans for your life? Do you have a vision for your life? Ladies, if that man ain't got no vision, why are you connected to somebody that's blind? And gentlemen, now I'm not talking to the seasoned one. I'm not talking to the sages on here. I'm not talking to the seasoned one. But listen, we got some young men on here too. She got a pretty smile and a big old butt and giant tatas, and she might be able to swing off of the chandeliers and all that. Do know that she's gonna get old one day. Them tatas are not gonna be up under her chin. Them tatas are gonna be down on her belly button, down in her lap. Will you still love her? Will she still be your friend? Can you guys still have a great conversation? Just because she's beautiful doesn't mean that she stimulate your mind. Ladies, let me tell you something. These men are real men are smarter than you think they are. You can be a beautiful face, got a beautiful body, you can have some great sex, but you won't be the choice. It's that woman that can stimulate his mind. It's a woman that can keep his attention. Men are attracted by what they see. Of course, they're men. They're attracted by what they see. Women are attracted by what they hear. In order to get to a woman's body, you got to get into their minds, talk to them, have a conversation. These older women, listen, more mature women, hey, let me tell you something. At one point in time, young women, you want the six pack, you want them to be 9'3", and all that great stuff. Now, we still got to have standards. You know what I mean? We still got to have standards. And when you talk to some of us older, more mature women, you understand that, you can't be superficial. Men are looking beyond superficial too. She's beautiful. She got a beautiful smile, but can she read? Or is she eating the books? Can I connect with her? And can she, listen, a woman can get pregnant and birth things. Can she carry the vision? Can we connect in the vision? Are we going in the same direction? Or is she playing football and I'm playing baseball? Or I'm swimming and she wearing a football helmet? So, men nowadays, they need a mature, sage man in their life to teach them how to be a man, how to have conversations. It's not about the big butt and the pretty smile. She ain't gonna look like that forever. You better look at her mama and see what her mama looked like. You better look at his, his daddy and see what his daddy looked like, and then look and see what their relationship is like, and then look at him. That's why the foundation, you want to be friends. You know, a narcissist tries to rush everything. They try to do everything really, really, really fast, because if I can get you, it's like a car salesman. If I can talk really fast and talk, and I'm trying to hurry up and get you to buy this car, and you look really good in this car. It's all about your feelings and emotions and how you look and how you present yourself. Slow your roll, Mr. Salesperson. Let me go take this car to a mechanic and let them open up the hood to show me things that I don't know anything about. Let me put it on the machine to see if there's any codes that run up on that screen. See, I used to work in a motor pool, Dr. Hooper. I used to be a PLL clerk, so I used to work in a motor pool. So I know about going to put the car on the machine and see if any codes run up to see, you know, what the codes on that engine are. We also now have learned, let me go and check the history of that vehicle to see if the frame of the car has been broken. If the frame of the car has been broken, how are you selling this lemon? You know what I mean? So a lot of people trying to rush, and a narcissist makes it really, really fast. They paint this beautiful picture and they move really, really fast because of the fact that they want to hurry, because they don't want you to catch the glitches. They don't want you to catch the codes that run up on that computer. Because if you pay attention, they tell off on themselves, but they hurry up and dismiss it. And I hope you didn't hear it. You know, like, I'm gonna give you an example, and then I'm done. I'm gonna give you an example. You go out to eat with this gentleman, or you go out to eat with this lady, and you tell them, I don't eat pork, or you tell them, you know, I don't eat meat. But yet they don't take in consideration, okay, I eat meat and she probably, or he doesn't eat meat, or I eat pork, but she or he doesn't eat pork. Let me show you how it works. Let me look and see for a restaurant that can cater to both of us. No, you decide to take them to the pig hut, and everything that they serve is pork. And so you telling them, oh, you know what? I'm so sorry. I apologize. But I told you ahead of time. But I've already told you. Me and you have this conversation. Did you forget that quick? And guess what we do sometimes? Oh, you know what? That was probably a mistake, you know. No. That's a red flag. Pay attention to that. Because if you've already said it, that man should be asking you questions. What do you eat? What don't you eat? You know, or what does, you know, you asking him questions. Oh, I know this really nice restaurant that caters to both of us. You know, I know you eat pork. I don't eat pork. Or they also sell vegan food. So, you know, exactly, clock it. You know, but you know, they also serve vegan food. Or let's think for a minute. Okay, ladies. Okay, I'm gonna use this in this humorous. Okay, it's humorous. A lot of us ladies like wearing wigs, right? Do you like, you know, hey, I have a convertible. Would you like to ride with me in my convertible? Ooh, okay, I tell you what, if I ride in your convertible, let me get a hat that I can strap down on my head that'll keep my hair from blowing up, you know. Now, what if that gentleman is like, you know what, I won't even put the hood down all the way, or I want, you know, in respect, you know, little things. You gotta notice the little things that people do. That narcissist, I don't care whether you wig come off or not. We gonna ride, you know, because now what they're doing is like, ladies, sometimes you take that as being cute. I'm just trying to show you off. I want people to see you. Am I a hood ornament? Sometimes ladies want to, and I'm gonna give you this example too. Pay attention when a man constantly compliments you on your looks. You're so beautiful. You so pretty. Oh my gosh, you got pretty hair. Your skin is so pretty. You got beautiful eyes. Y'all remember Madagascar, where he was like, you big, you sexy. And then the other hippo was like, yeah, I'm big and I'm sexy. You know, pay attention when you keep getting these consistent compliments. You so pretty. Oh my gosh, you got a beautiful body. Oh my gosh, your hair is so pretty. Your skin. After a while, it should make you gag. It should make you like, okay, I've already heard that. Thank you. You know, some of you guys are so desperate for compliments, and you feel so empty that when a man is given attention like that, or even a woman, sometimes a woman is doing that to a man, and sometimes you're so desperate that you want that, and they can pick that up. You got to remember that some narcissists who are men are still men. Men are still hunters. Men still pay attention. But a healthy man is not going to take advantage of that. A narcissist will take advantage of that. Oh, you desperate for attention. Oh, you want me to do that all the time. They know that's a weakness now. You got a problem with self-esteem. Oh, this is going to be easy. I actually had a man tell me that the worst sex that you can have is good. What kind of comment is that? The worst sex that you can possibly have is good. That lets you know that he himself don't care about you, period. It's a release, and that's a narcissist. It's a release. They can come through with all the antics. They pay attention to you to see how you respond. So they know what to do in the acting role. Whatever they have to do. A narcissist is a flesh feeder, is an emotional vampire. That's what they are, y'all. And if you have family members, if you've ever been in situations like that, now start paying attention to your family. Now start paying attention to some of the people that you in a relationship with and see if it's all about them. They can't handle constructive criticism, even if you're trying to be nice. Hey, sis, I'm not trying to disrespect you in any kind of way, but girl, you need some gum. Also, what you trying to say? Oh, you think you better than me? Oh, my breath stink? Oh, but yours don't stink. But all this time you've been blowing in my face and singeing my eyebrows, but you're going to come over here and say something to me. And you're thinking to yourself, whoa, this went from 0 to 100 like in 2 seconds. I'm trying to help out. What did I do wrong? I don't like the way you said that. You need to fix the way that you said that because that's very disrespectful. And I don't like you coming at me like that. And you're thinking like, what did I just do? What did I just say? And then you go back, well, if I said it the wrong way, please forgive me. But I mean, your breath stinks. You see what I mean? So some of you guys are quick to back out and be like, you know what? I shouldn't have said that. I'm so sorry. I shouldn't have said that. No, sis, listen, I love you and everything. You can get mad and I can understand you be embarrassed and everything, and maybe I ain't say it right. So if I said it wrong, that wasn't my, that wasn't my intention, but girl, you need some gum. I'm not gonna take that away. You need some gum or you're going to disrespect a lot of people. You see what I mean? But they're going to show themselves. They're going to present themselves. Yeah, excuse me. So does anybody else have any more questions? Because I know Just Be Real over there throwing timers and clocks and everything. So anybody want to ask anything else? And then I'm going to go. I'm going to let you guys go for the evening. But remember, pay attention to the superficial. When somebody over compliments you all the time and everything that they always say to you is superficial, is about how you look, how you smell. I mean, there's nothing wrong with somebody complimenting you. Hey, excuse me, please don't take offense, but you're beautiful and you smell good. You don't want somebody saying, you know what, you beautiful and you stink. Dang, you need to take a bath. Then you'd be embarrassed. You might need to go take a bath. But listen, but there's nothing wrong with getting a compliment. You're beautiful. I just want you to know you're beautiful and you smell great. Thank you so much. I appreciate it. There's a difference between thank you so much, I appreciate it, or hey, thank you. See, a narcissist pick up on that. Oh, she desperate. She like that kind of stuff. But pay attention to a lot of compliments on the superficial. Is beyond the superficial look because looks fade. And when looks fade, does that person still love you? Does that person still want to spend time with you? Do they still want to do right by you? Do you still want to do right by them? Do you still want to see them do good? Are you guys partners? Are you guys working together? Can this work? Does our vision connect? Does our life connect? If you're an accountant and he's a business owner, hey, this two can work. She might be good with handling the money. You might be good at making the money. She may be good at this and he may be good at that, but do you guys even compliment each other? But most importantly, are you guys friends? Do you even like each other? Because eventually when it doesn't feel like y'all love each other and I don't like you, but one thing I can say is I love him. I love her. And you ain't going to do nothing to my boo. Now you ain't gonna mess with my boo. Now we're gonna take care of my boo. I don't like him all the time. You know what I mean? So, you want a friendship. Stop trying to run into a relationship. You want a friendship. You want to get to know the person. How do they act when they get angry? How do they act when it comes to the waitresses and the waiters in the restaurant? Do they tip? Are they nice to them? Or do they feel entitled? How do they handle their parents? How do they act with their parents? How do they act with their ex-wives or ex-husbands? How do they act with their kids? Do their kids even like you? Do their kids like them? Do the kids like the mother or the father? If the kids don't like them, they're talking to, that's a red flag. How do they handle you? What do they act like when they're angry? Those are all the things. You got to have a resume nowadays, and you pay attention to a person's character. I'm grown. Y'all leave me alone. I'm grown. But you have to look at people's character. look beyond the superficial and look at a person's character. What is their character like? Do you like their character? Because personality disorders are character flaws, and they're permanent, and they get worse as they get older, get worse with time. So look, I'm grown. But you look at a person's character. You watch a person long enough, you can pick up on their character. All right, I'm getting ready to go. Oh my gosh. My moderators are no joke. And I had to tell them I'm grown. But all right, ladies and gentlemen, I am now concluding this broadcast because my moderators are messing with my grownivity. They're messing with my growntivity. Dr. Hooper said, it's not what a person says, but what they do. Bingo. That's exactly what I used to say all the time. Love is what you do, not what you say. Because what you say may not correspond with what you're doing. Can't slap somebody and then tell them that you love them. That's called trauma bonding. But listen, I'm a go. You are so welcome. You are so welcome. I'm a go because my moderators are about to drive to my house and knock on the door and tell me to get off of social media. I love y'all. Thank you so much for being my moderators. I appreciate all the time that you spend with me. And thank you guys for having a great sense of humor. And thank you guys so much for being here. Remember, I will be launching my module 1, session 1. It's session 1, is module 1 in the session 1. I'm making up words. Danielle ring the door, and Danielle know where I live. That's the crazy thing. But hopefully you get to come for Thanksgiving this year too. But listen, I will be launching the first session to my coaching institute. You guys stay tuned because I will be doing a Zoom, and it will be a free Zoom so I can introduce to you guys. Danielle tapping on my shoulder. But I will be launching a Zoom, and I will let you guys know where you can sign up for the free Zoom, where I'm going to introduce to you the Coaching Institute and what I will be offering you. The live sessions I will have after each one of the modules, which is actually the sections that I'll be going over when I do the modules. But after those, when you complete those, we will be having live sessions to go over those modules. But I will be introducing the coaching program. I'm just putting together the slides right now. So Dr. Hooper, I'm putting together the slides. And then after I get those out of the way, I'm working on the curriculum. I have the curriculum sitting on my computer. I have to tweak it so that it fits into every category that we were talking about. So I'm gonna go back and rewrite it. But the coaching program, you guys stay tuned because I will be launching hopefully within the next few days. I'm working on it because I have to do the slides that go with it and the workbook that goes with it. So I'll be launching the first section of the Coaching Institute. And so thank you guys so much for being here with me tonight. Thank you to my moderators and Just Be Real. I was going to put a government name out there, but Just Be Real is also my administrator, and my daughter is my secretary. And so when you get your certificate after you complete certification with my institute for coaching, I will also provide support in helping you maintain your professionalism because we are going to create some professional coaches so that you guys can go out there in the world and do some great things. A lot of you guys are like Danielle's in the hotel industry. I know Dr. Hooper's in the medical field. Some of you guys are in cosmetology or in the beauty industry. Some of you guys are into fitness. A lot of you guys are into different areas in your life that you're passionate about, and you can turn that into coaching. People, this is a $1 billion industry. People are paying for information. People are paying for coaching. You have these CEOs that need to know how to communicate with their people. There are people that need to know, those that are going back into the workforce, they need to know about how to write a resume, how to interview. You got mothers, first-time mothers that are needing to know about parenting and having a baby. There's some that want individuals menopause. They're menopause coaches, that are helping women through menopause. They're, all sorts of things. And so some of you guys are gifted. You're a nurse who's currently in graduate program for MHNP. Ms. J, you look at your industry. Dr. Hooper's a nurse too. But Ms. J, your industry could use coaching. You'd be surprised. Go look up the industry that you are interested in the coaching area that you're interested in, or maybe in the field that you're working in, and you'll see that there are people out there that need nurses. I have a lot of nurses that I see in private practice that need coaches, because they're young nurses going into a field. They're going into a field that's new to them, and so they're nervous. A lot of them have that imposter syndrome, and they need seasoned nurses like yourself or like Dr. Hooper. They need some seasoned nurses to help them get beyond that imposter syndrome, and they would love to have coaches like you to help them. So see, there's billions of dollars out there consultants need coaches too. Some of you guys are new in the industry, some of you guys are older in the industry, and but you guys know it, so you can be a coach in anything, and people are paying for it. And so this is what my coaching program is going to offer to you, so that you learn the basics about coaching and how to develop your coaching program, how to develop your niche, or your niche. I like to say niche, to develop your niche and to actually do it. And it is a business. People call themselves coaches, but it's not even, they call themselves coaches, get paid for it, but they don't understand business. They don't understand taxes. They don't understand business names, branding yourself, none of that stuff. And so I'm going to be assisting you and giving you that information with my coaching institute. And I will release the name when I release the very first section of coaching. And I will release the name as an intro to you. And so thank you guys this evening. I was getting sleepy. You hear me getting sleepy? Thank you so much for supporting me. Thank you guys for being here. I hope you have a wonderful, wonderful evening. Thank you so much. And you guys have a wonderful evening. She's tapping on my door. Tap, tap, tap. But you guys have a wonderful evening. Good night, everybody. Have a great evening. I'm getting off. Good night, everybody. Have a great evening. Good night. Good night, everybody. Have a good evening.